Hello, world. So, as we know, this pandemic situation is unfolding all across the United States, and we don't even know. Quite honestly, we can't even project the amount of time this is going to take to clear. So, the situation is not just affecting the healthcare sector by overwhelming facilities and the hospitals that are short on staff and even the supply chain infrastructure. Right now, even the military is overwhelmed. The Pentagon is saying that there are certain spots all across the United States that they're watching. Most of them on the West Coast, but oh no, actually they're not. They're kind of spread. There, there's a certain number of places where we have concerns, and they are Chicago, Michigan, Florida, Louisiana. Hayden told a group of reporters when asked where field hospitals could head next. And this is the thing, because our hospital sector is so overwhelmed, or it's as of the moment they are capable of taking care of the people who are coming in, but because the spread of the virus and the people who are coming up with symptoms and complications is growing exponentially. They are preparing ahead of time, and they are calling the armed forces to help with their field hospitals. And for example, here in New York today, Cuomo it showed us on his daily briefing. Um, I think it was 1,000 beds field hospital that was assembled by the Army Corps of Engineers here in New York, and he's asking the federal government to help by provisioning three more of those so that we can have 4,000 beds. And then on top of that, in addition, there is also a where did I see it? There is a ship, okay? A naval hospital ship arrived on Friday in Los Angeles, and another one is expected to reach New York City on Monday. So, on Monday, in addition to the four field hospitals that Cuomo is asking for, we also have a Navy ship hospital that's going to be docking on the New York Bay. And according to what I understand, this Navy ship hospital is not really going to be used to treat coronavirus patients, but simply to help take the pressure off of the other cases that the local hospitals are dealing with here in New York. And that is good news, because if people need health care while in the middle of the crisis, going to a hospital at the moment might not necessarily be a good idea because they are risking getting the virus. Now, if you isolate these Navy ships, these floating hospitals, to take care of those people who might be injured in urgent need of care, you might be able to take care of them and help them through the crisis without making things worse. So that's a good thing. And another point of interest is that right now they're trying to take care of the situation in the places where we have a higher concentration of people getting sick. But the Pentagon is also saying that they're looking at places like Chicago, Michigan, Florida, and Louisiana. And it is interesting because as we went into lockdown, a lot of people started flocking out of the lockdown areas out of New York, and they started moving to all other states. And inevitably, a lot of those people, unknowingly, were probably taking the virus with them and just spreading it around. And so apparently, we are going to be seeing major outbreaks in these places. They're not explicitly saying that in this news report, but they are saying that they're watching those places, and if they're watching those places, it must be for a reason, right? So there's that about that story.